Health experts are warning that the rise in the number of people with diabetes in England threatens to bankrupt the NHS. New figures from Public Health England suggest that 5 million people will have the disease by 2035, most of them with type 2 diabetes, which is closely linked to being overweight. The cost of treating the condition and the complications that arise from it is predicted to soar, as our health correspondent Dominic Hughes reports.
This is the human cost of type 2 diabetes. Aged just 47, Ghassan Hassan is a few hours away from having his left leg amputated. An infection in his foot threatens his life, and he's now paying a heavy price for underestimating the dangers of type 2 diabetes.
It's not easy, when you get faced by, when you got told you're going to lose a leg or an arm. So I've done everything right from the time I was, diagnosed with the diabetes. I would be okay by now.
The tragedy is this life-changing operation was entirely avoidable. Type 2 diabetes is linked to weight gain and a poor diet, and if the condition is managed badly, the complications are serious. When he was first diagnosed, Mr. Hassan never imagined that it would come to this, that one day he would lose a leg. But diabetics are also at risk of blindness, kidney failure, even premature death. In England alone, in 2015, there were nearly 4 million people living with diabetes. But new figures from Public Health England predict that if obesity rates continue to grow, by 2035 the figure could have leapt to nearly 5 million. Across the UK, the NHS currently spends around 10% of its entire budget on diabetic care. But the most recent analysis predicts that figure could rise to 17% if rates continue to grow.
There's a real risk that the cost of managing and providing the right level of support and care for people with diabetes will bankrupt the NHS on the current basis. So we have to really understand how we tackle this issue of the rising numbers of people with diabetes, in particular the rising number of people with type 2 diabetes.
I developed type 2 diabetes by having a sweet tooth mostly. I used to try out every new sweet.
16-year-old Aisha is one of a small but growing number of children who are also developing the disease. Cutting out those sweets and fizzy drinks has helped her lose a stone in weight.
It's been really hard at times, but you can only have health once and you can't really buy your health. You have to keep changing your diet plan to whatever it is, and also keeping fit and healthy.
Staying healthy will require a lifetime's work for Aisha. And a few days after his operation, Ghassan Hassan is urging others to learn from his mistake.
Diabetes, now I know how very horrible disease, nasty. You need to be careful of everything.
Mr. Hassan's was one of 140 amputations linked to diabetes carried out every week. The personal and financial cost of this disease is growing by the day. Dominic Hughes, BBC News.